Today on Jenny Jones, Jenny's own painful story about her breast implants and the medical uncertainty she faces every day.
I'm angry and frustrated and scared.
Plus, look at both sides of the breast implant controversy and an update on what every woman should know. And now, here she is, Jenny Jones.
Thank you very much. Today's show is very important to me and to a lot of women. You may have seen this People magazine cover with my face on it. It's about breast implants. If you've seen the news, read newspapers, picked up any magazines over the last couple of months, you have been listening to stories about breast implants, and mine is not particularly a good one. The first thing I want to do is to tell my whole story, part of which was reported in People magazine, part of it they didn't have room to put the whole story in. I've also invited 4 other guests, a plastic surgeon, a psychologist, and 2 silicone implant recipients, one who has a good story to tell, one who has a bad story to tell. And the first thing I want to talk about is why I decided to go public. And I'm doing this because I'm angry and frustrated and scared. About 10 months ago, I had my 5th set of implants put in. And at that time, I was told that the old ones had ruptured. It wasn't told to me in any kind of a scary fashion. It was just, and in fact, the way it was told to me was frustrating. I'm angry at the doctors because of their attitudes, because he wasn't even going to tell me they ruptured. I found out by accident by the nurse walking me over to the doctor and saying, "Oh, I heard that they ruptured. I was in the surgery." I said, "Well, he didn't tell me that." And I went in to see him, and I asked him finally, and he said, "Oh, yes, they did." But there was no hint of any danger. Just they ruptured and we put the other ones in and just go home, and that was the end of it. After the FDA story started coming out, I wasn't that concerned about the rupture. I didn't think it was dangerous. Nobody told me it was. I started hearing all the stories from the FDA. Then I went back to get checked again, and what I thought was scar tissue, what I was told was scar tissue, turns out to be silicone in my tissue right here on the chest. And not only that, but I said, you know, when he told me it was scar tissue 9 months ago, I said, "What do I do?" He said, "Well, you just keep squeezing the breast to break that up." And it was silicone. So, I mean, it's been a lot of frustration. But I'll give you the quick chronology. I had my first implants in 1981. They hardened fairly quickly. I had them redone again a year later. They got hard again, and by now there was scarring and the third time, one got hard, one didn't. They don't match. One was higher, one was lower. It was just very, very frustrating. And each time I thought they were going to help me and this was going to be the time that they would wind up being soft, it was still just a cosmetic issue. It was not a medical issue until just recently. The last time I had these put in, which are misty gold implants right now that I have, there was a red spot that appeared and they didn't know what it was, and all these specialists are looking at me saying, "Gee, we don't know what it is. It may be a reaction to the silicone. We're not sure." It took about a month for that to go away. And then I started hearing about the news of the dangers, the possible dangers of silicone and the polyurethane coating, which my implants had. And I decided I couldn't keep this to myself anymore, and I made the decision to go public to make it okay. We have to. Everybody's afraid to talk about this. Nobody wants to talk about it, and we have to talk about it to get anything done, to get the help that we need. It's the most difficult thing I've ever had to say publicly. It's very embarrassing, but my feeling is if anything good can come from what happened to me, is to keep it from happening to somebody else. When we come back, I'll tell you why I did it and answer any questions that you have here in the audience. We're back talking about breast implants, a very important issue, and we're about to take some audience questions, and you go ahead and ask your question.
Good afternoon. As a young woman growing up, was there someone in your life who teased or ridiculed you that prompted you to have your first implants?
Well, I was teased a lot growing, in my teens because I was, fairly flat-chested. But I think probably more of the message came from my father, who I don't blame for this, but because he didn't know better. But he unfortunately was a breast man, and my sister was big-breasted, my mother was big, and he would tell me to, you know, take cold showers and put cold water on my chest so they would grow, and do these special exercises. And I sent away for that Mark Eden bunk developer. Remember that thing with the spring? I sent away for that. And I had certain there were two moments that always stood out in my mind. One was when I had a tube top on. We were going to, I was 30 years old already. We were going to a party, and he said, you know, could you put a jacket on? It's kind of embarrassing to go out with you looking like that. And those are the things that stay with you. He didn't know. It wasn't his fault. They just didn't know any better. And so I think that's where it started, you know, and part of my message today is for parents not to really watch what you say to your kids, you know, because same thing when I'm out at a store and I see a mother with a child and the child does something and the mother says, oh, that you're so stupid. Those things we can't do that. We have to stop doing that. So there's yes, what's your question?
Yes. What did actually prompt you? What made you feel the need to have a breast implant?
I had thought about it for a long time, and I always thought it was something that famous people did and celebrities did. And I was working as an office manager at the time, and a lady that worked with me had them done, and she came in and she was showing us all, you know, she was so, and I thought, wow, real people have this done too. It wasn't just for movie stars. And that's when I said, if she can do this, I can do it. And actually I wound up going to her doctor, and I didn't have the money. I had a garage sale. I sold everything, you know. It was $1,500. I sold books and clothes and pots and pans and anything I could live without, I sold to come up with the money to pay for it. And unfortunately, now that I have money, there's nothing, I don't have any amount of money that can buy back what I gave up. Yes.
Jenny, I'd like to know, how can you get romantic? How can you get intimate?
That's a tough one. Yeah.
I too had them 16 years ago, so I know what you're going through.
Did it work out well for you? Mm-mm. It didn't work out well.
As a matter of fact, a lot of my relationships have ended. I can't get intimate. I can't. You got these rocks on your chest, you know.
Yeah, you had the same hardening problem that I did. Mm-hmm. Yeah. It's very hard. It's funny how things come in cycles, because originally, when I was flat-chested, I was embarrassed to be with a man, and I thought, well, because, you know, I wear these padded bras, and I thought, well, eventually he's going to have to see me without a bra, and it's going to be embarrassing. And now it's the same thing, only worse. Now it's, gee, if I have to be with a man, he has to see me. It's 10 times worse than it ever was before. It's a very difficult area, because I don't want to embarrass Dennis, who I've been involved with for a long time. Thank God for him. If I'd have known him 10 years ago, I never would have had this done. But the fact is that if I'm touched there at all, I have to block that out and forget about it to even enjoy being touched anyplace else.
What's left for us?
What's left for us?
Mm-hmm. As far as getting intimate with a man, as far as...
You have to find a guy like the one I have that really, really doesn't care. And there are some out there, because I know I found one, but I don't know. I wish I had all the answers. I don't have them.
Thanks.
Hi, yes, Jenny. I didn't know do you know what the side effects or the symptoms were when they had ruptured?
No. I don't know when they ruptured. That's the problem. In fact, I broke my shoulder last year, about just a little over a year ago, ice skating, and I fell, and my arm was up, and all my body weight landed on the left breast. My entire body weight, flying through the air, landed on the breast. I went in to get checked, and I said, do you think it may have ruptured? And they checked and tested and felt, and they said, no, it seems fine. It was already ruptured. It had been ruptured. The problem is he couldn't tell me when. When he opened up to put these new ones in, he said, it was ruptured. We can't tell you how long. It's been some time. It could have been 5 years ago, 3 years ago, 6 months ago. That's one of the problems, is you can't tell. But one of the facts I'm finding out now is that all silicone implants will leak some. Some of them will rupture completely, which is what happened to both of mine. But you can't tell. That's one of the frustrations. You don't know.
I've had mine done. I have that fear, because you have no idea when they'll be ruptured.
No, you have no idea. Are you okay now?
I've had mine for 2 years, knock on wood, no problems.
Yeah. The problem is you can't. There's no way to know. How can you test for it? It may feel fine, but I think, well, we have more information yet to get. But that's one of the things that I didn't want to hear, was that they all leak at some amount. Yeah.
Hi, Jenny. I would like to know, how do your family feel about this situation you're going through now?
They just found out. I didn't tell anybody. I was too embarrassed to tell them that I was having problems. And so this story was coming out this week in People, and so I called my mother, like I would call her every other day and kind of say, there's a story coming out, and And she said, I didn't know you had any problems. And so I broke it to her gradually because it would have been such a shock to see the whole thing.
Well, are they supportive with you now?
Yes, very supportive, especially, well, Dennis is the only one that really knew all along what was going on. But they're mother's concerned. My mother's concerned for me. But they've been terrific, but they didn't know. They really didn't.
Okay.
Yes.
Hi, Jenny. I'm curious to know what kept you from asking more questions as soon as you started having problems, and even before your initial surgery.
The question I asked was, tell me what the risks are, and what the risks were, where they might get hard. That was it. There were no risks. I'm not sure the doctors knew anything more then. This was 10 years ago. At that time, I was told that, I said, well, how many get hard? He said 10%. Well, I found out since then that it's never been 10%. It's always been 50 to 60%. But I did ask, and there was, even last year when they ruptured, it was like, yeah, they ruptured, and we put the other ones in and go home. They don't tell you.
What can women do now? What do you recommend they ask?
Everything. First of all, I was told that there is a pamphlet or a flyer or some paperwork that goes with the implants. They should let you look at that. It was never offered to me. You just go in there and they put them in. We have to ask for information, but we're getting it now. We won't have to ask anymore. Hopefully, because of all this, we won't have to ask. We will just be told. But that's what this is all about: is to get the information so we can make decisions based on some knowledge. I had no knowledge, none.
Okay, thank you.
Hi, I'd like to know how pressure from your adolescent years affected your self-esteem and impacted your decision to get the breast implants.
Well, people don't know, they really don't know what they're doing when they make jokes. I used to be teased all the time about, awful jokes that I can't even repeat, but, people give me t-shirts with 2 fried eggs and they thought it was really cute. It's not cute anymore because it really does stay with you, It was, that's what we have to change that from not just how we treat our children, how we treat each other as adults too. Yes.
Hi, you were saying you had 4 or 5 implants done?
This is my 5th.
This is your 5th.
Yeah.
Did you
it's like a transmission. I had the 5th ones installed,
Did you ever think of having them removed permanently, or do you have that option?
That's what I wanted to do now. In fact, my last visit, when I heard all this news now and was concerned when I went back, and he told me this is silicone and I'm so unhappy with them, I said, I want them all out. I said, take the implants out, take this silicone out. I don't want it, I don't care anymore. And he said, if you do that, you'll be suicidal in 2 weeks. So I'll leave it at that. We'll pick this up as soon as we come back. Also going to have a psychologist on who will tell us why the way women look affects the way that we feel about ourselves. Our breast implant story continues. I want to answer the rest of this last question, and I want to really make it clear about my own personal story and what my options are and where I stand now. The implants that ruptured were silicone. They had the polyurethane coating. So I have the polyurethane coating somewhere in there. I have silicone, at least where I can see it, possibly other places, I don't know. My 3 options at this point are to leave everything as is, which is this particular implant, which is called Misty Gold, which is pretty much untested. It's not silicone, but it's also untested. It's made of silicone, the outside, but the inside is some kind of, I don't know what it is exactly, some kind of a gel. So my options are first to leave everything as is with these new ones and the silicone ridge sitting there, which I don't think I want to do. Second is to take everything out, which is remove the implants, which would require basically reconstruction because the skin has stretched and so on. It also would require taking out the silicone out of my body, which would, the doctor said, leave a substantial deformity because they have to take skin with it. So, his analogy was it's like marbling in beef. You can't just take them, you have to take all of it out. So it may require taking some skin. The third option is to have saline implants put in and still take this silicone out, which will still leave a deformity where the silicone is, and to possibly go with saline. So those are my options, none of which I like, unfortunately. And that's why I'm here today, out of frustration and anger. And I may not be the only person in the spotlight right now, but I'm certainly not the only one who's been insecure because of my body, because that's how it started for me. About 1 million women have had breast implants. 80% of them are for cosmetic reasons. Now, I have to tell you something kind of funny, actually. Did you remember reading that it was 2 million women all this time in the news of the last month? Well, guess what? It's only 1 million because they were counting implants, and it was 2 per person. So it's only 1 million women. So I think that's so funny. Anyway, My first guest says that women have never been encouraged to accept themselves for who they are instead of how they look. Meet psychologist Ann Kearney-Cooke. Welcome back. Every woman I've talked to about this said that they have either thought about doing something or they're unhappy with something about their body. We are so caught up in how we look. What do we do about it?
Well, first of all, I think for women there's a body, what I would call body role parallel, meaning that your role in life is very much determined by how you look. And that puts tremendous pressure on women to look good. And in the 90s, looking good has meant having big breasts, no hips, and being thin, which is biologically impossible, which I think leads many women to engage in surgeries or activities which are really harmful.
Now, what do you do? How do you begin to turn that around?
Well, I think it takes tremendous courage to turn it around. I mean, I think first of all, it means women beginning to take themselves more seriously and not just reacting to every fad. I mean, breasts were not in 10 years ago, the Twiggy figure was in. Now breasts are in. So your body can be in and out depending on the year. And how can we as women take ourselves more serious and figure, instead of reacting to all these ideal bodies.
Are we doing it for men? Because, you know, men, let's face it, we had a show one time, something, I forget what the show was about. We surveyed all of our male staff members about what makes a woman sexy, and the number one thing on almost every sheet was big boobs, big breasts.
Well, breasts have been over-sexualized. They're used to sell products. But again, that's what men think. I think that what's important is how do you figure out what makes you feel sexy? Like, did you feel that when you got the implants, Jenny, that you felt sexier or were freer or felt more feminine?
I did for about the first couple of months. And then, you know, when things started to go wrong, they never felt like a part of me. They were soft for about 2 months, which was great. And then after that, it was just one problem after another.
Because I think what happens is we're sold on this idea that if you do this, you're going to be sexy. Sexuality is not about big breasts. It's about being able to be vulnerable, about being able to trust and being able to experience your body and the other person's.
See, I can look at a flat-chested woman now who's completely flat-chested and see her as very sexy. I envy her for having her own body, but I could never see that before. But now that I've experienced this, I really look completely beyond this shell that we carry around that really isn't that important.
Well, I know often I'll ask people, have you ever fallen in love with someone that's not a perfect 10? I mean, even the audience, have any of you ever fallen in love with someone that's not perfect?
Sure.
And yet we sometimes, especially women, I think, feel like the only way that we can be lovable or sexy is if our breasts are perfect, if we have no stomach, if we have no wrinkles. And the reality is that none of us look that way.
What about the women who have had things done who are happy? They're out there. A lot of women have had implants that are happy. They'll say, I feel sexy, or I wear better clothes.
Well, I think what happens with plastic surgery is that when you have plastic surgery, you often change your relationship to your body. So if you have a nose job, for instance, you may now look in the mirror and say, you know, my face isn't that bad. And then your behavior changes, because you might say, boy, I'm not looking that bad, and I'm going to get some colors and fabrics that I look good in, and when I go out socially, I'm going to be friendlier. So really, it's your behavior that's changed. And I think sometimes that instead of going to such drastic means as surgery or eating disorders, sometimes working on our image.
You can change your behavior from the inside as opposed to changing it from the outside. And we have a couple of audience people that wanted to talk. I saw your hand from the back of my head. Yes, go ahead.
Hi, Jenny. I have a question for the doctor. I have a feeling that it's women who perpetuate this feeling about the way women feel about their bodies with magazines like Glamour.
Are you saying men have nothing to do with it?
Certainly they do have something to do with it, but I think women perpetuate more of this feeling by looking at magazines like Cosmopolitan, Glamour, which on every cover shows a woman with very large breasts. And they try and idealize that as the perfect ideal woman. And I don't think that's correct either.
It's probably as much women comparing themselves or trying to be like other women as it is trying to look good for men, don't you think?
Yeah, I think what it is that often what we're seeing in magazines is a very distorted version of what people really look like. And I think that real power comes from figuring out how you can look your best and not always reacting to what a magazine or what the media is using to sell a product. But I think both goes on, that women compare themselves to other women and try to meet this ideal that they think men have.
We're not all intended to look like that. I mean, some of us are intended to weigh more, some to weigh less. A lot of these models that you see are anorexic women with breast implants, and it's not real, and that's not what we're intended to look like. I'm getting angry. Okay, but we'll take a break. When we come back, a plastic surgeon and 2 women who've had silicone implants, one with good news, one with bad news. All right. We should know within 60 days whether or not the FDA will let some women get silicone implants, with certain restrictions, of course. Commissioner David Kessler has to decide how safe those implants are based on his panel's recommendations. And joining us right now are people with different points of view. Our first guest was unhappy with the size of her breasts, so she had silicone implants put in about 6 years ago. She's had very little trouble with her implants. She loves them, and she thinks other women should have the opportunity to get them if they want to. This is Barbara Runyard. Welcome, Barbara. But she's probably lucky, according to our next guest, because her silicone implants gave her nothing but trouble after she had them put in following mastectomies. When she finally had them removed, she says doctors found silicone in her tumor, in her ovaries, and in her liver. My goodness. She founded the Command Trust Network, an organization that gives consumers information about breast implants. This is Sybil Goldrich. Welcome. Now, most plastic surgeons say that very few people suffer medical problems from silicone implants. Our next guest has put silicone implants in her patients and even says she'd have no reservations about putting them in her own body. Meet plastic surgeon Dr. Roxanne Guy. You absolutely would put them in your own body?
Yes.
You think there's no risk at all to having silicone? Because you know that I don't agree with you.
Oh, I know you don't agree with me. I think that there's a risk to all surgery. And I think that when we talk about the breast implants, there are the known risks that include capsular contracture, which it sounds like is what you had.
Yeah, but that wasn't a medical problem. That was just a cosmetic problem that they got hard. But now there appears to be some medical risk to the silicone being in the body. And
that's right. There are the known risks, and then there are the supposed risks. And when the FDA got together, the panel, they wanted to look at 3 things, basically. They wanted to look at, is there a correlation between the implants and cancer? Is there a correlation between the implants and having a hard time reading mammograms? And lastly, is there a correlation between the implants and an immune disease? And I think we've pretty well dispelled the first 2. Cancer, we have some good studies that show out of UCLA that there isn't a higher incidence of breast cancer in women with implants.
It may not be breast cancer, it may be another kind of cancer when this stuff travels through the body.
There isn't any scientific evidence to prove that there is a
Well, that's
cancer
because there hasn't been
link.
any testing yet.
Oh, there's been a lot of testing.
They're not, huh?
There have been a lot of testing.
Go ahead, Sybil, yes, you can.
Well, what I wanted to say is that there really hasn't been adequate testing. And there are long-term studies, the few long-term studies that we do have. One of them, the Deep and Brody study, does show that there is an increased incidence of another type of cancer. But that doesn't mean that we can relate that new cancer to this. Mm-hmm. I think what we have to focus on now is that we're in a very difficult transitional period. And women must know now what they must do to arm themselves for this difficult transition. Everybody must know that if you decide to have your breast implants removed, they are your property. You go home from the hospital with them. You should be able to call any physician's office and obtain copies of all of your records. Every single record from every single doctor you have seen since you had your breast implants put in initially.
Do they have to give that to you?
Yes, and the sad thing is that many women have had their implants for 15 and 20 years, and physicians don't, in many states, have the legal responsibility to maintain those records. So it's important that you always have records of all of your medical visits.
Dr. Guy, do you do that? If someone calls and asks, will you send a complete record of their medical?
Sure. There's no argument about informed consent. I think that is absolutely a very important point here. And I think that women need to be told, everything that we know right now about the implants before they even consider getting them.
What are you telling them about the autoimmune disease?
I'm telling them basically what the Food and Drug Administration panel decided, which was that after looking at all this evidence, and obviously it's been really hyped up by the media and by some anecdotal people who have had problems, after looking at all the evidence, it was clear that the panel said that they can't find a scientific link between autoimmune disease and the silicone and the silicone implants.
Jenny, it's still mentioned in the package insert, which means that the manufacturer believes that there is enough reason to mention it and tell you about it so that you should be aware of it. That has been in the package insert since 1985, though it has not been made common knowledge. Now, we recently have had released about 800 pages of documents from Dow Corning which would substantiate some of the problems that we're having with autoimmune response, because with defining whether there is an actual autoimmune response. Because what's happened is the studies that were done were inadequate, inappropriate, and did not really measure the issue. So with the information we have now, we have to assume, regardless of what the FDA says, that it is a possibility that you should consider as a downside risk before you consider getting
Barbara,
breast implants.
are you concerned?
About the autoimmune
About anything, any autoimmune disease, cancer, anything, arthritis? Are you concerned at all? You can't be watching all this stuff in the news every day and not have some kind of thoughts about yourself.
Well, I think it needs to, you need to evaluate the patient beforehand if they're predisposed for various autoimmune diseases. You know, if you have a family history of arthritis.
I asked you if you're concerned about yourself.
I have a family history of arthritis. And yes, I do have arthritis. But for me to turn around and say that it's caused from my implants, I don't believe so, no.
Did you have it before the implants?
Yes. Yes.
Well, the other issue here is that there's other ways to change your body image that don't involve surgery. I mean, one of the things that I thought was striking about Jenny's history is that she had a father who had a negative reaction to her body. She was teased during her adolescence. There were many things that happened that made her vulnerable to messages that your body needs to be perfect. And there's guided imagery and there's cognitive behavioral techniques, talking therapies that can help people change their body image, that there are no dangers, there's no risks that we've just heard, and I think we need to really look at that too.
And Dr. Cook, if I can just add a point to that, you know, I think that your point is well taken about doing different things to change your body image or to make you feel better about yourself. But if you look at the majority of women, I think that both Sybil and you, Jenny, don't represent the majority of women. The majority of women are happy with their implants. And let me just finish this point because I think this is really important. And we looked at a profile of women who have implants, and the profile of the majority of women who have implants are in their 30s. They're happily married. They already have a couple of kids. And they go to the doctor to have implants because they'd like to put back what they lost after breastfeeding or after their two pregnancies.
But the thing is,
they're in a stable relationship, and their husband doesn't care whether they have it or not. They want to do it because they just want to.
Where did you get this information?
We have this information through the ASPRS.
The ASPRS studies are guided in such a way as to
what is that study?
But we also have the studies through Dow Corning. Dow Corning is doing ongoing studies about breast implants. And
again, they've been proven fraudulent in a court of law.
But the thing is,
we don't know where to go.
The thing is, we may be a minority.
That those people wouldn't be happy going through some body image therapy.
That's
the same
right.
women, and there's no risk for them. You don't know if these women in their 30s, 15 years from now, are not going to have some problems.
Who's going to dictate?
Let's help women begin to take their health more seriously.
I agree with that.
See, we may be a minority, but we are still, even if it's just the two of us, that's two people too many to have any kind of complications from implants.
Without having been given prior information as
Three
to
of
what
us.
the risk
How many
was.
more? Who's had complications in this audience? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There's 12 people. That's 12 too many. I go to my doctor and I say, let me just finish with this. I went to the doctor and he tells me I've got this silicone. I said, is this dangerous? And he said, we don't think so. I said, tell me something. Is it completely safe? He said, well, there may be a 1% risk. 1% is too much. We'll be right back. part of the room applauded when the doctor said that most people were happy, and you were one of the people, so what do you want to say?
Well, first of all, you said that your implant had ruptured and you had no way of knowing whether or not it had ruptured. Had you ever had a mammogram?
Absolutely. I had mammograms every year.
Then those will, in fact, detect a rupture. So obviously...
They didn't with me. They didn't with me.
Jenny,
well, it will.
There are several different types of mammograms that women with breast implants can have. One of them is a displacement mammogram. It should not be done by a technician. It should be done by a radiologist. And a zero mammogram will also show where there is a break in the implant.
I told the person that I had implants. I went to the breast center in Los Angeles. That's where they specialize in breast reconstruction from cancer and implants and everything, and no one ever detected it. So have you had implants?
Yes, I have implants, one for mastectomy, one for a reduction to match the reconstructed side. I'm very happy with it. Have I had complications? To me, they're an annoyance. Not
what kind of an annoyance?
I've had some scar tissue buildup. I've had the implant removed and replaced. I'm very satisfied with it.
You know, it depends on how much you're willing to put up with on a certain level. However, it's the...
There are risks to hormone replacement therapy. There are risks to birth control pills. I break out from sulfa drugs. I have a friend who goes into anaphylactic shock from penicillin. But don't take them off the market. Make yourself aware so that you can make an informed decision.
The issue is that nobody was given that information to make an informed decision.
Well, I wasn't.
Were you told that you could get an autoimmune response? Were you told that silicone was inert? Were you told that silicone could end up in other parts of your body?
I got a copy of the insert from the implant packet.
What year?
What kind of implant?
I have low bleed silicone implants made by Mentor.
And what year were
88.
In 88 you were given the package insert before the surgery?
Of course.
Well, you have a remarkable situation.
I know.
To do it just for cosmetic reasons,
why should you have to go through a life-threatening illness to have implants to feel
No, I'm saying not a cancer patient, but someone like me who did it just for cosmetic reasons. It's stupid. It's stupid. If there's any risk at all, it's stupid.
Yourself, it's not.
I don't. Yeah, what do you want to say? What do you want to say?
Jenny, what I'd like to know is, what about us ladies who had it done in the early 70s, in 73, 74? There was no information. We were told that it was just as easy as pulling a tooth. There was nothing available to us, and we went to the medical experts. We don't know about, I don't know about plastic surgery. All I know is I got these things in me now. Am I going to die? I'm a single parent. I can't, I can't go out and meet people. And my mom just died. And I buried my mom 2 months ago, who had these put in the same day I did from autoimmune disease. Now tell me, no.
Did she have a history?
She had these implants put in, and she had to have them removed, and we both went simultaneously to get them squished when the scar tissue, so to speak, built up around it. And I lost my...
That's what one of the things that they're telling us now is that all that squeezing that you're supposed to do to break up that capsule is going to make them rupture. Let me show you how thin they are. First of all, this is...
I'm wondering, though, is why are we so willing? I mean, one thing I'm hearing is, well, you just have to put up with these irritations. Why are we so willing as women to put up with so many... Why is the price of beauty so high? I mean, I think
here's
that in some way
my price of beauty right here. This is a ruptured silicone implant. It just... Can you see what it does? It travels throughout the body. This is a regular silicone implant, okay? Let me show you how thin this is. Get a close-up of this. This is the new one. They're making thinner so they'll look more natural. Can you see how thin this is? Look at this. All right?
In fact, they're not making them thinner. They're making them thicker. The thin implants came out in 73 and 74.
What's
and there
this
has
one?
been I have no idea where that came from, but I've never seen an implant like that in my life.
Who brought this in? Did you bring this in?
A lawyer.
Tell me, what do you, yeah.
A lawyer?
A lawyer brought it in.
I got this from a plastic surgeon. These two, and this is how thin they are making them, and the silicone bleeds right through it. But what the women have to realize is you can't go to a plastic surgeon to find out what's wrong with the implant. You have to go to the manufacturer. And as Sybil brought up earlier, they were found fraudulent in a court of law.
And we were never
by a jury.
The ones that saw the documents, the plastic surgeons are operating in the blind. They haven't seen the documents that we've seen. that the jury did see and what the public is now being able to see.
In fact, the plastic surgeons did see the document. The 90 documents that they asked for from Dow Corning.
Dow Corning just released 800 documents that you have never seen before.
There's a silicone implant research committee.
I have 4 cratefuls of documents,
There is a silicone implant research committee that has looked at those documents, and they have agreed with the FDA panel in saying that they can find no scientific link between immune disease and silicone.
We'll be right back.
Hello, Jenny. Earlier in the show today, you had mentioned about your options if you had everything removed. You said if you did, it would be suicidal. Could you tell me what that
I guess he was trying to make his point that both the last 2 doctors that I consulted with said if I did what I want to do, which is to remove the implants completely and this silicone ridge, that aesthetically it would be so bad that I would really, really not like it. They both said, you're really not going to like this.
That's your mental attitude would be?
Yeah, that I would be so distraught that I'd want to kill myself. No, I don't believe them. I will be distraught. I know that. Now, Barbara, you work in a plastic surgeon's office, right?
Right.
What do you want to say?
In everything you do, there's an element of risk in everything. And I viewed the risk that I was going to go through, and I went ahead and I feel that because my breasts are all right, I also had scar tissue contracture. I've had more than 1 surgery, and I'm still happy with having it done.
But why aren't we able to say that the natural sequence of the body is that after you have children, your breasts, I've had 3 children, your breasts look different, and that's natural, and why can't we love that and say that's part of life?
But everybody's opinion about themselves is different, and they should be given the right to choose. I think that's what this is all about, is the right to choose
I agree
what you
with
want to do with your body.
But to be able to make an informed decision, which we have not been able to make up until now, it's the information that we need. Yes?
Yeah. I'd like to address the doctor who seemed somewhat cavalier about putting implants in anybody, because I'm from the Scleroderma Foundation, and a lot of women have scleroderma that feel that the breast implants have triggered that. And don't you think there should be some pre-screenings or there?
Scleroderma, just for those who don't know, would you explain what it is?
Scleroderma is a hardening of the tissues of the skin. It is a connective tissue disease, and basically we produce too much collagen in our systems, which causes hardening. And when that leads to hardening of the lungs or hardening of the heart, it can be fatal. Absolutely.
There's definitely a possible link between that and implants, as far as from what I've been seeing and reading.
Absolutely. It's also in plants where people work with silicone or various forms of silicone that scleroderma has developed in these plants. And
isn't that a concern?
That's a different, it's silica where that has been shown to occur, not silicone. They're 2 completely different.
That is a synthetic silicone.
They're completely different products. And I really didn't mean to sound cavalier at all about putting implants in, quote, anybody, because I think patient selection is extremely important. And I myself spend at least an hour talking to the patients before I have them get their silicone implants.
Do you do
medical
histories? Have you ever turned somebody away because they could be
I certainly have, about 10%.
Who would you turn away?
Predisposition to a disease.
About 10%, yeah.
For predisposition to autoimmune disease?
Yes.
What other reason would you turn somebody away?
If I feel that their reasons for having the implant are wrong. For example, I have a lot of people who come in because they're distraught after having a divorce, and they think that this is going to get them back on track. Hiddenly, sometimes I think the agenda is they'd like to get their husband back, or they'd like to win that job, or they'd like to, any number of things. And that's the wrong reason. The reason to put an implant in it is because I just want to. I want to make augment my appearance. There's no overwhelming sweeping.
I just want to?
Yeah, I just want to.
Jenny, I think we should question that basic premise, because I think women are trained that to be loved, you have to have no wrinkles, big breasts, no fat. I think men are taught that men are born with a sense of entitlement, most men, that you're going to be loved for who, what you see is what you get. And I think we need to question that premise that we have to be something to be loved, and it's going to entail surgeries and dieting and laxatives and all the things that women do without question.
I knew that we weren't going to have all the answers today, but I think we all share the one same common goal, all of us do, that we do need more information. And when we come back from break, please get a pencil because I'll give you some phone numbers that are very, very important. We'll be right back.
For a transcript of today's show, please indicate show date and topic and send $4 to Jenny Jones Transcripts in care of Burrell's, Post Office Box 7, Livingston, New Jersey, 07039.
Hi, I'm Jenny Jones. Do you think it's hard to find eligible guys these days? On my next show, you're going to meet some bachelors who, instead of trying to meet the right women, are trying to buy them by shopping through the mail. I'm not kidding. Plus, it's Academy Award time. 3 of the hottest Hollywood gossips will be here with the news on all the nominees. Plus, we'll talk about who wasn't nominated and why. It's all on the next Jenny Jones. Brides for Sale and Oscar gossip.
That's tomorrow on Jenny Jones.
Some phone numbers if you need more information about silicone implants. The FDA has set up a hotline for information. You can call 1-800-532-4440. Sybil Goldrich has established a consumer information network for women who want information about breast implants. You can get in touch with her by writing to the Command Trust Network, 256 South Linden Drive, Beverly Hills, California, 90212. And the Medical Alert Foundation has established an international breast implant registry. It's a nonprofit organization. You can call for information. That number is 1-800-892-9211. This is a new registry, I personally am joining it myself. It's the first really big one, and you can put yourself in to be followed up on future tests. You get information about your own kind of implants. It's really, I strongly suggest joining the registry for anyone that's concerned. There is a subscription fee, but you can check on that when you call. I want to thank all of you very much for coming on, especially you both, because you knew that this was not going to be an impartial host today, and I thank you all very much for this terrific information. And before I end the show, I want to put out my own personal message, and that is I would like to urge any celebrity with implant problems to please come forward and use your power to demand more information. You have the power, and with that power comes a responsibility that I also feel I have as a performer to all women with implant problems to please come forward. And also the women, any woman with problems, don't let embarrassment keep you silent. Please come forward and talk about it. We need to know you're out there. We can help each other, but we have to speak up. Also, if you're still considering getting implants, please get the facts. We are getting more and more information, but you must demand the facts and know and make a very informed decision, because we will get the information out, but please inform yourself if it's something that you really want to do. My advice to you personally is don't do it. Not for cosmetic purposes. It is not worth the risk. And forget the medical risk. If it was perfectly safe, there is still a bigger issue. Small breasts are not the problem. It's how harshly we judge ourselves and how we judge each other. So please, my message to you is tell your daughters that you value them for who they are, what they do, not what they look like. Thank you very much. Thank you.
Accommodations provided by Hotel Intercontinental Chicago, ideally located on Michigan Avenue. Enjoy the distinguished services for which Intercontinental hotels are renowned worldwide. If you enjoyed today's show and want to attend a taping of Jenny Jones in Chicago, call 312-836-9485. Don't miss out. 312-836-9485.
Weeknights on Channel 9 have twice the laughs with back-to-back episodes of Who's the Boss at 6 and 6:30. Plus an unbelievable pair of families, starting with the Bundys at 7. And don't forget those hilarious Huxtables on The Cosby Show at 7:30. It's all coming up tonight on Channel 9.
This is a David Saltzman production in association with Telepictures Productions, distributed by Warner Bros.